So the first age group that we're going to talk about this week is the preschool years. There's a couple things that I want to make sure that we remember about the toddler years before we really jump in. So toddler years, what would you guys say is Erickson's stage for the previous stage for toddler years? What's Erickson's stage of development as a toddler in? You guys
One
remember?
to three
So
years.
they're 1 to 3.
Shame.
So yeah. So infant is trust versus mistrust, and then the toddler is going to be autonomy versus shame and doubt. And then what do you think the stage is for preschool? What's the third stage?
Initiative versus guilt.
Initiative versus guilt. Very, very good. And also for toddlers, some things that we talked about. So there's some key points here you need to remember. So birth weight doubles by 6 months, it triples by 1 year. And then how much does your birth weight change between birth and 3 years? Does anyone know?
It's a triple.
So a little bit more. So a 3-year-old should be 4 times his birth weight. So if you were like 6 pounds at birth, how much should you weigh by 3 years?
24 pounds.
24 pounds. Okay, very good. Some other key things about toddlers that I know that you need to know for your coming up quiz is how many hours do they need to stay dry before you start potty training them?
3.
2.
2.
2. What can you tell me about language development in a toddler? Like how much should they speak? How much is it all understandable, not all understandable? How many words do they use together?
2 words together.
2-word sentences. Very good. What else about toddlers? 2 important things about teeth. So 6 months is when you first get your baby teeth, and in 6 years you start getting your adult teeth. 6 and 6 toddlers. I think that's the main thing. And then who can tell me the difference between cephalcaudal and proximal distal?
I don't know how to pronounce it well, but subperconal is when the head starts to develop before the rest of the body.
Okay, very good. And what's the other one? The proximal distal.
It's when the center of the body, like the abdomen, starts to develop before the extremities of the body.
Okay, very good. So those are some key points that you need to remember for the quiz that we're going to take at the end of class. And I appreciate everyone for speaking and participating. So good job, everyone. So we're going to move on. So the information that we're going to talk about today, which is going to be preschool, school age, and adolescent, that is not on your quiz. So it's really last week's information that's going to be on your quiz today. So the preschool kids, and your classmate was right. So this is going to be your initiative versus guilt. So you want them to develop a sense of initiation, and you want them to want to try new things and not feel guilty that they're a bad kid. Some things that we talk about, these kids are not as chubby, they're not as low to the ground, they're starting to grow taller and thinner, their gait normalizes, they're starting, they have all of their primary teeth in, so they're able to eat totally normally. You should expect, a kid to be either right-handed or left-handed by the time they're 3. And just kind of in this age group, every year they're just getting more and more kid-like and less sort of baby and toddler-like. So Piaget, so the first stage of Piaget is sensory motor, which is the infant stage. And I think that stage really, the sensory and motor, the name of the phase really kind of describes an infant. They sense everything with their hands and their touch and their mouth and their sight and their smell, and they're moving. But the second stage for Piaget is this pre-operational phase. So this is a stage where they don't really have logical thought. And he divides it into 2 different phases. So the kind of like the early years, 2 to 4, is preconceptual, and then intuitive thought is 5 to 7. Preconceptual is really defined by a lot of very brisk language development. This is the stage where kids are really learning a lot of vocabulary and they're really learning to talk, but they don't really have logical thought processes. And then, we always talk about like the toddler, this 2 to 4 range. This is really egocentric person. Like everything is about them and about what they want, and they're the center of their universe. As they start having more complex thoughts, you're going to see 2 different terms, and both of these are terms that you need to recognize and be able to define. So animism is the belief that inanimate objects have human feelings and intentions. This is like going, the belief that your doll is your little sister or has a personality or that you can talk to them. And then artificialism is the belief that, environmental characteristics have human qualities, like saying that the wind is blowing because God is angry, or that it's raining because someone's crying. So like as in this age group, you understand how you feel and how you react, and you kind of put that out to the environment and your toys, etc. So these are some sort of key principles of like Piaget at this age group. This is the age group where you're going to have like imaginary friends, because you're believing that your inanimate objects have personalities and characteristics of humans. So in this age group, they're really focused on the here and now. Like they don't really have the ability to think about the future, and they don't really care about the past. So everything is kind of still egocentric, themselves, and what's happening to them at this exact moment in time. And we talked about this last week. If you're ever assessing a child and you're noticing problems in hearing or speech, that you need to do like a deeper dive into what's going on. If they're not meeting their milestones, it could be something's going on at home. There could be something physiologically wrong. Maybe they, had some undiagnosed brain damage at birth and now they're not developing normally, or it could be psychosocial, or it could be, just not getting enough nutrition. So always think about the whole person and all the different factors that could go into what's impacting a child's development. So there's some very specific things, one of the things that parents struggle with the most is bedtime routines. So, kids, who's a parent in the room? Like who has a kid that hates to go to bed? Has anyone experienced that? No one?
Yeah.
Mine are older now, but I had that experience when they were younger.
Okay. So what did you do as a parent? How did you get them to kind of get into routine and get them to go to bed?
We followed, my youngest is on the autism spectrum, so we really had to follow a strict schedule because he's very schedule and routine oriented. Like he's 14 now and we still follow an extreme schedule. Like if things are off by a couple minutes, it throws him off. So everybody, since he's the youngest, everybody in the house kind of just followed suit.
Okay.
with having a schedule.
Well, so that, actually that's kind of what is recommended, right? That, you don't want to be like playing really rough or like doing something really active right before you want them to go to bed. So try to get them into this quiet activity, kind of get them slowing down before it's bedtime, and having very specific routines. Sometimes it's like, first we take a bath, then we brush our teeth, and then we read a book, and then it's lights out. And it's the same thing every night. So they sort of get into the routine of like calming down and then going to sleep. A lot of times kids will get into this thing where they're like, I'm hungry, I'm thirsty, I have to pee, and all these other things, and they're just trying to get out of going to bed. So this is one of those things that as a nurse, you need to be able to do anticipatory guidance about teaching parents not to kind of give in to these reward seeking, attention seeking behaviors, and have like that strict routine, because kids really need to sleep. And so you need to get them on, and also like, you're setting yourself up for further conflicts as they get older. If you're not able to establish that routine as a toddler, then they're going to be kind of more rebellious going forward and less likely to kind of follow the rules as you kind of go through childhood. So establishing that routine, and bedtime is something that's clearly a problem for a lot of parents. A lot of kids just don't want to go to bed. So we talk about, play being the work of children, and there's, specific types of play that we talk about. So, it usually starts with parallel play. This would be like two kids that are near each other, but they're not interacting at all. And then associative play is maybe like two children playing with blocks, and they're cooperatively building a tower. And cooperative play is like more of talking with each other, working with each other, maybe like a board game or something like that. So they start kind of younger. This is going to be like maybe your toddler is going to do parallel play, and then getting into preschooler, they're starting to do the associative play, and certainly by the time they're school age, they're able to do the cooperative play. So that kind of builds on each other. And just remembering that kids, they need to play. This is how they learn to socialize and how do they interact with other people. Something that's very, very specific in this kind of age group, and it's something, when you're doing like education in the hospital, is they really have like a fear of bodily harm. They have a fear of having their arm cut off, or sometimes they just kind of don't understand that something could happen, it's not permanent. So just to recognize in this preschool age group that they really have that fear of bodily harm. And they also they're still kind of egocentric, and they can get really angry if you take their toys or anything away from them. So as you're kind of getting older, they're becoming, more and more, they think more clearly, they're more logical, you can have more conversations with them. This 4-year-old is like really a lot more physical. They're able to run and jump and skip. They like to show off their new skills. And they're starting to like tell stories, but they still like the really ones that are kind of simple, and they should have like a 1,500 word vocabulary. Their speech should be totally, you should be able to understand them. They speak in complete sentences. This is the why stage. Why. And just kind of remembering that you want them to want to take initiative. So you want them to try new things, and sort of trying things that they're going to be able to good at. So, making sure that you have toys and stuff like that are age appropriate, where kind of they learn skills and they can feel good about themselves. So we talked about this, it's 1 minute per year of age for timeout. So this is a good sort of parenting technique in this age group. If they're 3, they should be in timeout for 3 minutes, 4 for 4 minutes. And you do want to, focus on positive behavior, positive reinforcement, but try not to constantly giving bribes. Kind of make a difference between telling somebody they're doing a good job and then telling them to do something to get candy or food. You want to focus on the positive, but not necessarily bribe them. So another thing, so the sort of the main conflicts that parents deal with in this age group is that bedtime routine and their kids not wanting to go to bed, and then thumb sucking. So who in the class has had a child that sucked their thumb past the age of like 2? Did anyone have any thumb suckers? No? What do you think you do as a nurse? Is it okay if a 3 or 4-year-old is still sucking their thumb? Or is that a problem?
A problem.
So we generally say it's a problem if they're still sucking their thumb when they start school. So like 5 or 6, we would say it's a problem, but a 3 to 4-year-old, we usually don't make a big deal out of it. Usually they don't really have their permanent teeth in too much, so you're not going to cause like too many dental problems. And the thing is, you want to kind of focus on the positive. So if you see them stop sucking their thumb, you're like, oh, good job. But you don't want to put like hot sauce on their thumb. You don't want to punish them a lot when they're sucking their thumb. So this is a tricky stage for parents, but the main thing as a nurse is you don't want it to be you don't want to make a big deal out of it. You don't want them to feel guilty for sucking their thumb. So you want to really focus on the positive and not focus on the negative. And really, definitely by the time they're in school, they should not be sucking their thumb. But if they're still kind of that 3-ish, 4-ish, it's probably okay. And you can just kind of wean it off. Another thing that parents really deal with is bedwetting. So enuresis is the medical term for bedwetting. So there's two kind of broken down into 2 categories, primary and secondary. So primary is the kid's never been dry. And secondary is that they were dry for a year and now they're wetting their bed. It's more common in boys than in girls. And then this organic causes, these are things that could be physically wrong with the child that's causing them to wet their bed. So like a urinary tract infection, diabetes mellitus and diabetes insipidus. So this is going to be your diabetes that you normally treat with insulin, and diabetes insipidus is a brisk urine output. It's usually pressure on the pituitary gland or something going on with the pituitary gland. Seizures, and obstructive uropathy. So there's like an obstruction somewhere in the urinary tract, or other abnormalities of the urinary tract, or like a sleep disorder. So, certainly you need to be paying attention to what's going on if someone complains about bedwetting, and always thinking about like what could be causing it. So other than organic causes, what other things do you think? Why might a child start wetting their bed? Like a secondary, they were dry for over a year and now they're wetting their bed again. What do you think could be going on other than these causes here?
Some
They
sort
might
of
be
abuse.
stressing about something at home.
Yep. Very good, both of you. The abuse and the stress, right? So this is definitely something that you need to think about. It could be like a regressive behavior. Something's going on that's stressing them out. It could be abuse or parents are fighting or something like that. And then they start wetting their bed after they had been dry. So there's some,
It can even be like something small too, like even if there's like a change in routines at the house.
yeah, like you're moving. Yeah, exactly. Thank you for pointing out. It doesn't have to be like something major. It could be something, you know, like
Right, like it
they
doesn't
moved
have to
or
be
they changed
traumatic. Like
schools.
I just know from my own experiences, like it could be something really simple that still stresses them out, but it's not like traumatic.
Yeah, or it is traumatic for them, but it's not like,
Right.
you know, it's not
Right,
like
it's
they're not being
traumatic to
abused.
them.
Right. Yeah, very good. And as a nurse, you know, you want to make sure that you want to document everything to try to figure out what's going on. Like, is it just at night that they wet, or do they also have accidents during the day? What is their urine like? Does it have an odor to it? Is it a small amount that's concentrated, or is a lot that's really dilute? And is it painful at all when they pee? Thinking about like, are they drinking right before they go to bed? Is there any sort of a family history stress? Are they taking any medications? And then like, you know, what was their potty training experience like? And you know, were they ever completely dry? So these are all different things that you're going to think about. There is, you know, training for kids that really have problems. They can end up in a management program to really try to do like cognitive behavioral therapy to help them stop. You know, some things you should also do is, you know, not drink too much after dinner, and then make sure children pee right before they go to bed. And then there's all of these different, you know, options: counseling, hypnosis, behavior modification. There's sometimes there's medications, and then bladder training exercises. So most people don't get to this, but if, you know, for families that have a lot of, you know, for kids that are wetting their bed and it's not stopping, it can be really stressful. So to know that all of these options are available, and it just requires a lot of documentation and questioning from the nurse to try to figure out what's going on. So preschool, generally speaking, we say preschool is good for kids. So if you ever have a parent ask you if their child should be in preschool, if they have the option, the answer is yes. And what do you think? Why do you think preschool is important for children? What do they get out of going to preschool?
A social
They learn to,
experience.
yeah, they learn to follow rules. They learn to interact with other kids. What else do you think might be positive about preschool?
They also learn to be away from their parents.
They learn to be away from their parents. And depending on the preschool, they might actually start learning some stuff that they're going to learn in school. They might start learning their letters and colors. Not to say the parents don't teach that, but they can kind of, you know, get a head start in going into school. And it does help with their self-esteem, because they're like learning that they can do things that they might not necessarily be exposed to at home. So generally speaking, preschool is good. So if parents have the option to put their kid in preschool, for socialization and development, it's good. You know, I'm sure most of you know this: when you're in big groups, then you're also going to be exposed to more infections and stuff like that. So parents should kind of be aware that their kid might get sick more if they're going to preschool than if they were home all the time. But the risks are less. The benefits are more than the risks. There's a lot of benefits to going to preschool. So I think the kind of the end of this presentation, I think it's stuff that's pretty self-explanatory. You know, they don't need as much constant looking at. They're able to dress themselves. They are able to, you know, make more decisions for themselves. They don't need as much one-to-one care as they needed when they were younger. But you still need to be thinking about like accidents and accident prevention. They should still be watched around pools, you know, boiling water, hot stove, etc. There's still that age where they could accidentally get themselves into trouble. So they definitely still need supervision, but not quite to the extent they did when they were younger. And I talked about this, you know, this is this age group when they have a really active imagination. They have imaginary playmates and imaginary friends. And so the stages of separation anxiety, this is something that I know is tested. I definitely know it's on your exam 1. And it's also the discussion question the same week that you have your exam. So I just want to point this out as something that I would pay attention to it in the book. And separation anxiety can be, you know, leaving your kid at daycare. And also we talk about it a lot in terms of a kid being in the hospital. So like a kid's in the hospital and mom and dad both work and they can't be there all the time. And then the kid goes through the separation anxiety. So the first stage is protest, and this is where the kid's like really upset, crying out for their mom and dad all the time. And then despair, they just are sad, but they're not crying, but they don't really want to interact with your environment. And then the detachment stage, like they're gonna like focus on being okay, like holding it together. So they're gonna play with their toys and they're gonna ignore their parents when their parents come in. So sometimes this detachment page can be really hard for parents. Like kid's sick, mom and dad leave the kid in the hospital and they come into the kid's room and the kid's like, I'm not talking to you. I'm here with my teddy bear having a good time. And they're not, they do miss their parents, but they're pretending like they don't as like a coping mechanism. So I would just make sure that you recognize this, and it's really protest, despair, and detachment. Regression is on this slide, but the ones that we focus on in terms of like what's going on when you leave them is going to be this protest, despair, and detachment. So I would just pay attention to this in book, and I'm pointing it out because I know it's on your exam one, and it happens to be the same discussion question for that week. So you're not going to have that much time between reading about it and being tested on it. So, just generally speaking, when you're dealing with toddler preschoolers, I'm sorry, always remembering kind of that where they are cognitively, like early on, they're really learning a lot of language, and then a little bit getting closer to school age, they have this very active imagination and they're starting to think more, but they don't really have those logical thoughts. And play is really important, and paying attention to how they play with other children. If they're starting to get into like associative and cooperative play, what their coordination is, they should have like a hand preference. They should be eating independently. They should be able to dress themselves. They should be potty trained. So I think that's the main points. We're going to watch a quick video that goes over Piaget, and then we're going to talk a little bit about Colbert, and then I'll give you guys a quick break. So let me pull up the video really quick.
Of cognitive development is the next topic. Now, the NCLEX and most exams will test your knowledge on this theory by asking you how to teach a child. So if you get a pediatric teaching question, they're really just testing you on the knowledge of Piaget's theory. So Piaget's theory is 4 stages of thinking. Be sure to write this down. So first stage is 0 to 2 years old. We call this the infant and toddler stage. So the stage is sensory motor. The child thinks in the present moment through senses and not past or future, as mentioned by Hesse. Another main characteristic of this stage is object permanence, where objects are still there even if you can't see it, like playing peekaboo. For example, covering a toy with a blanket and uncovering it, kind of like peekaboo or Jack in the Box toy. So that's why this type of toy is the best for this age group. But we're going to cover that in the play segment. Now, as far as teaching, be sure to write this down. We always teach in the present moment. That is huge. So teach them what you are doing while you are doing it in the present moment. Now, as far as pre-procedure teaching, this is mainly for the parents and not for the child. So, for example, Foley catheter insertion for an 18-month-old child. Teach the child what you are doing as you are doing it in the present moment. Now, the next age is 3 to 6 year olds. These are our preschoolers. This stage is defined as pre-operational thinking. So just think pre-operational thinking for preschoolers. They're very imaginative as well as symbolic thought with magical thinking. They do not understand cause and effect. For example, scraping their knee was caused by earlier misbehavior. They understand the future and the past. Now, a little side note here. Another big example on most exams is if the child is adopted and finds out that they're adopted at this age. They often feel responsible for being adopted and find it difficult to understand, often thinking it's their fault since they don't understand cause and effect. So trust me, this was a big one on the NCLEX. Now, in terms of teaching, teach the child shortly before a procedure. Teach them the day of, the morning of, or even a few hours before here. For example, a Foley catheter insertion for a 4-year-old child. Teach the child what you are going to do. The key word there is what you're going to do. Now, the next age is 7 to 11-year-olds. This is our skill learning stage. Now, it's characterized as concrete operational thinking. So these children have logical thought, they follow rules, and have rigid thinking. So there's only one way to do something, as mentioned by ATI, and it's defined as limited abstract thoughts, as mentioned by Hesse. So for the memory trick, just think 7-Eleven mini marts. They have a bunch of concrete all around the mini mart. There's no trees or grass. So concrete thinking is between 7 and 11, like the 7-Eleven mini marts. Now, in terms of teaching, we always teach the day before a procedure, and we include skills like insulin injections. So we show demonstration and often provide reading. So for example, teach them tomorrow we will, or you will do this every day. Another example here, which child can the nurse teach bandage placement skills? 7-year-old and up. Now, finally, our last age group here is 12 to 15-year-olds. These are adolescents, defined as adult learners. So the stage here is formal operational. They're developing abstract thought. Be sure to write that down. Abstract thought is what they're mastering. Basically, cause and effect thinking. For example, love, hate, and morality. And in terms of teaching here, we teach them like an adult. Again, be sure to write that down. We teach them like an adult. It's basically med-surg style. So remember, 12 years and plus, or 12 years and up, they can manage their own care. So teach them, report these findings, or if you see this, follow up with your provider. And another example here, which child can manage their own care? The key term there is manage their own care, just like an adult. 14-year-old with diabetes mellitus type 1. Now, a big NCLEX tip to write down, risk-taking behavior. They're very non-compliant here. So this age group, be sure to write this down, they're just like adults. They're risk-taking and they're non-compliant, especially our diabetic patients. Okay, now you're probably asking yourself, what do you mean by risk-taking behavior? Well, just think about it here. Teenagers have this sense of invincibility, thinking that nothing bad will ever happen to them, wanting to fit in with their peers. So a top missed NCLEX question here that over 65% of students got wrong. A 14-year-old with type 1 diabetes admitted to the ICU with a blood glucose over 500. What is contributing to the non-compliant behavior? The client's psychosocial developmental stage. Yes, our adolescent teenage clients are the rebellious ones. Think rebels without a cause type. So encourage compliance and reinforce patient education in a friendly, constructive manner. So this is always priority.
All right.
HelloFresh has made my life go.
Okay. So I think that does like a pretty good overview of Piaget and you know, focusing on the fact that Piaget is the cognitive theorist. So it talks about how children learn. And I also know that you need to be able to sort of identify the age with the name of the stage. So you know, we talked about babies are your sensory motor, and then your preschool are your pre-operational, concrete is going to be your school age, and then formal is your adolescence. And you should be able to pick out certain characteristics for each one of those stages. So, you know, we're in the preschool, we're talking about the pre-operational, this is your imaginative thinking, um, imaginary friends, etc. And we're going to move into concrete operational on the next PowerPoint slide. But concrete operational is the stage where this is where they're getting good at math. This is when they're able to have more cause and effect, logical thought processes. And then the later stage, the formal operations, your adolescence, this is when they're really abstract thinking. They understand cause and effect. They can think about other alternatives, and they think much more like an adult. So, I mean, there's only 4 stages for Piaget, but it's just like Erickson, they're going to be on all of the tests. So I would definitely pay, like, the 2 theorists that I know that you need to pay the most attention to are going to be Erickson and Piaget. So I'm going to go ahead and pull up here Kohlberg, because we didn't really get to Kohlberg last time. Kohlberg is the moral theorist. It's another one that you definitely need to, you know, be able to think about what Kohlberg is saying and to identify different age groups for Kohlberg. So hopefully this gets bigger here. Um, okay. So this goes through, you know, the stages here, and then it has the age range next to it and the description. So when you're an infant, you don't really have like a moral compass, right? There isn't, you don't really have any sense of morality. But what it starts with is this avoiding punishment. So as an infant, you do things because you don't want to be punished. And then as you kind of get older, you're starting to think about what your interests are, what stake you have in a conflict. And then school age, you're starting to think about conforming to social norms, the good girl, good boy concept. And then as you get into teens and adulthood, then you're really thinking more about principles and general ideas of what we think of being something as being moral, you know, doing something because it's the right thing to do, not because how it affects you or how other people perceive you. So they kind of build on each other. And you know, a lot of students kind of struggle with this. The only thing that I can really say is that avoiding punishment really sticks with you. This is, you know, even as an adult that has like this full sense of morality, you might still drive the speed limit because you don't want to get a speeding ticket. Like this idea of like, I don't want to get punished, it kind of sticks with you even as these other layers get built on top of it. So this is Kohlberg. And does anyone have any questions about that or have any concerns about what Kohlberg was trying to tell us about how we develop our sense of morality? No? Okay. So I'm going to go ahead and move on to the, let's see here, the school age PowerPoint. Okay, so school age, we're moving on from preschool to school age. So this is going to be our 6 to 12-year-olds. So, you know, school up until they really start puberty. So they don't really have imaginary friends anymore, but they still really are engrossed in fantasies. These are kids that are going to like stories about witches and magical things like Harry Potter, stuff like that. This is like the age group where they're really into that. And this is also where they really first start to form like real friends. You know, preschool and toddlers, they might hang out with other kids. It's kind of like play dates that their parents arrange. But when you're getting into school age, these are kids that are choosing who their friends are and forming their own peer group. So they start to feel like they're being judged for their performance. So this is the first time where kids really are paying attention to how they compare to other children and like making comparisons also in their own mind. So you really want them to develop that sense of industry. So does anyone know, out of curiosity, what Erickson stage is the school-aged kid going to be in? We said the preschool was initiative versus guilt. What follows initiative versus guilt?
Is this the skills one? I don't
Yeah,
know.
it's the one where they compare each other. There's always two, like trust
Yeah.
versus mistrust, autonomy versus shame and doubt. There's always
Is
like
it like
two.
competence? Something versus
Yeah,
competence?
yeah, very close. So it's industry versus inferiority.
Oh,
So
okay.
you want them industry or competence, like you want them, this is where you're, you want them exposed to things that they're good at so that they develop that sense of industry and they don't develop a sense of inferiority. So yeah, so every stage you should be able to think about what where the theorist would put them. So school age, this is going to be your industry versus inferiority, and we just talked about Piaget, so this is going to be concrete. So because I know what all of your tests are going to be like, so you need to be able to think about when you're seeing an age group, you need to be able to be like, okay, Piaget would put them here, Erickson would put them here, and these are the characteristics of that stage, because those are the types of questions that they're going to ask you. They're not going to ask you to like, to name the stages. They're going to give you an age group and have you think about how that age group is different based on the different theorists that would put them in that stage. So, Piaget has them in this concrete. This is when they're really starting to get good at math. They're starting to move just from learning to write to understanding. They're getting much better at reading. And this one thing in terms of anticipatory guidance. You don't want them to be unsuccessful in multiple things, because then they'll develop that sense of inferiority. So you want them to try new things, but to also be aware of what they're able to do, so that then when they try something new, they're good at it, and then they're going to be more willing to keep trying other new things and develop that sense of industry and not a sense of inferiority. So this slide here kind of goes through the main theorists. So Erickson, industry versus inferiority. Freud is going to be your sexual latency. Piaget is your concrete. So what do you guys think? Sexual latency, what do you think that means? Like what would be going on in Freud's theory? How would you describe sexual latency for this stage? What's going on? Are they playing with their same gender peers? Are they interested in other peers? How are they developing in that
They
sphere?
Would
stick
more
to
with their
like
own.
their own peers
They
mostly.
stick to their own peers mostly. Yeah, this is this age group when you're gonna get the girls hanging out with the girls and the boys hanging out with the boys. They don't really have the hormones. They don't really have that sexual interest yet. So there's a lot of good things that happen during the latency stage. This is where they really start to develop friends, but it almost always is the same sex friends. So girls are friends with girls and boys are friends with boys. So infancy, toddler, preschool, they're growing quickly. This is where you're starting to get like a slowdown in their growth. It's pretty normal that they kind of get pudgy before they grow taller when they're in adolescence. So they gain a little bit more weight, and like I said, they start to kind of get pudgier, and then you'll see them grow taller once they hit adolescence. They're also like muscle coordination is getting better. Toddlers are kind of low to the ground and kind of unstable in their gait, so they're starting to like become more stable, have more muscle coordination. This is like the age group when they're going to start being able to really play sports, etc. And we talked about teeth. So you're going to start getting your adult teeth around 6. This is why this is this age range. You want to make sure they're not sucking their thumb when they're getting their adult teeth in. But before that, you can kind of focus on the positive and not pay too much attention to whether or not they're sucking their thumb. Their GI tract is more mature, so they're going to be able to eat more, but they don't need as many calories, right? Because they're not growing as much. When you're born, your heart is really big in comparison to your thoracic cavity, and it starts to grow smaller and be smaller in proportion. So sometimes we generally speaking in society, when we see somebody who's big or tall, we think that means they're more mature. So just always remembering that developmental maturity has not anything to do with size. So a big kid or a tall kid or a kid that looks older is not developmentally more mature. You should be paying attention to their age and how you assess their cognition and not their size. So just generally speaking, how we develop our sense of gender is going to have something to do with our family and our society and our school. So just kind of thinking about, there's not really a lot of sexual attraction going on, but this is a time in their life when they're starting to develop their gender identity. So, we talked about not wanting them to develop that sense of inferiority. So having realistic rules and guidelines and also holding them responsible. So, if they're not doing their homework, if they're late to school all the time, they're partially responsible for that. And then you also need to follow up with the family, because what could be going on at home that they're not getting to school on time and they're not doing their homework. So just paying attention to these things, kind of recognizing that kids should be getting more and more responsible for their activities, but then also thinking about the fact that the kid lives in a family and in an environment, and all of that will influence their ability to do well in school. So I feel like this slide's a little bit silly, but just um, remembering that kids use slang words, and if if you're working with this age group, to kind of know and understand the language that they're using. So the end of this sort of presentation kind of goes over age by age of the school age years and kind of pointing out some key things. So, a 6-year-old, a lot of energy, likes to do tasks. This is like the age group where they're going to want to help set the table. They're going to want to help cook dinner. They like to really be given things to do. They're very, very talkative. Sometimes you feel like, why is this kid still just talking, talking, talking? But they like to tell stories. Another thing that's really important is that they still need a lot of sleep. Kids really need to be getting enough sleep for them to be able to do well in school. So they really should be sleeping 11 to 13 hours a night. Um, so, in this age group, um, starting to get them used to having responsibilities, making sure that they're considering their homework to be their responsibilities, but then also recognizing that they need time for rest and they still need to play and they still need to be a kid. You still need to be talking about immunizations in this age group. Most of their immunizations are before they get to school, but there's still immunizations throughout childhood that they should still be getting. Um, so, 7-year-olds, they start to continue that sense of responsibility, and they set standards for themselves. They want them to be good. This is when the stage where they want to be like the good boy or the good girl. And then some things that 7-year-olds should be able to do: they should know their seasons and their months. They're certainly getting better at math. And they're still really playing, but they also like to do maybe some quiet activities like writing or having crafts or something like that. um, as you sort of move through the school age years, you're going to want to start playing sports, being involved in group activities. um, it can start kind of at the end of the school age year. This is going to be like this hero worship, like thinking Britney Spears is the best person ever, or really, really focusing on like a famous person and really worshiping that person. So by the time you're into this 8, 9, getting into the end of school age, this is when kids really can play competitive sports. They can be argumentative. They might like to argue. You might need to teach them how to express anger, and something that we need to think about as a society. We tend to, allow boys to be more aggressive than girls, and I'm not saying that that's good, but we need to just be thinking about, teaching children how to express anger, and paying attention to whether we allow kind of disruptive behavior, and giving them boundaries and limits. This is this age group when you're going to probably start seeing that. So by the time you're 9, 10, you're more interested maybe in board games, hanging out with your family. It's not so much the active play is not as important. So board games, hanging out with family, but then maybe playing sports, but not constantly on the go when they're playing. And they're more able to accept criticism. So when they're younger, they fear criticism, or they might lash out and get angry. But the time they're kind of 9, 10, they can take some more criticism from their family and their friends. So as they get older and they do more sports, etc., you need to make sure you're talking about helmets, safety equipment when they're playing sports. Also thinking about motor vehicles, making sure that they're wearing their seatbelt. And then at the end of school age, this is when we're getting into the pre-adolescence. And we'll take a break and then we'll talk about adolescence after break. So some things to remember is that children are starting to go into puberty earlier. So you might start seeing like signs of adolescence in 10, 11-year-olds, especially in girls. And this is the stage when they're going to start being more sexually curious, in the latency stage for Freud, kind of that main years of the school age years are kind of hanging out with their own gender. And kind of as you're getting towards adolescence, this is when they're going to start to maybe be interested in sexual desires or having more sexual feelings. So certainly in adolescence, they're really, really preoccupied with their appearance, but you're going to start seeing this, especially since kids are going into puberty younger, where they start taking more of an interest in their personal appearance and start thinking more about how they're being perceived by other. Girls tend to be a little bit more mature. They tend to go into puberty earlier, and they might seem more poised or put together than boys, and that's normal. They might also be taller. They grow faster. They kind of go through that growth spurt and go into puberty earlier than boys. So, you know, they're, hormones are the main thing that's driving adolescence. So you're going to start seeing this hormones start and like behavior changes starting right before they actually hit adolescence. So, because of all of their hormones, they might have inability to really concentrate. They might seem preoccupied. They might not be able to concentrate as much. And they might, just be kind of worried or concerned about what's going on with their body. So they might be asking questions and they might be embarrassed. So you need to just kind of be paying attention and making sure that you're able to answer their questions. You always want to use like factual information. You want to make sure that you're being non-judgmental and letting them know that you're a safe person that they can come and talk to. Once they're kind of getting into that adolescent age group, they're able to understand more. They understand more cause and effect, so they need to be able to understand why parents make a decision. Before that, it's like it's just the punishment. The parents are the rule makers, but they should be able to understand why a parent makes a decision. The parents can have more logical conversations with them, and that's going to carry out throughout adolescence. So always thinking about, children, school is their work. So if they're not coming to school, if there's not, if they're intelligent, but they're not getting good grades, if they're missing a lot of homework, you need to be figuring out why, doing a deeper dive into what's going on with them, paying attention to their family, talking to them, talking to their parents, seeing what's going on. So, certainly by the time they're heading into like junior high and high school in their adolescent years, they need to be taking responsibility for their homework. A good idea is to have an allowance where they have specific chores. They start understanding the sense of responsibility, and it's not a bad idea to put like a monetary value on it so that they sort of understand what it means to be responsible. And at this stage, they certainly should be able to follow rules, participate in the household chores. As a parent, you should be making sure that they have like a place to study and they are following up on their homework and taking that responsibility. So those are the first two PowerPoints. Does anyone have any questions? No. Okay, so I'm going to go ahead and give you a 10-minute break. So go ahead and come back in 10 minutes. And then we'll do adolescence. I think we'll have time for the Kahoot, and then you guys will take your quiz at the end of class. So I'll see you guys in 10 minutes, okay?
Okay.
Okay, so I hope everyone had a good break. I'm gonna go ahead and get started with the adolescent section. I'm pretty sure I'm still sharing my screen, but let me make sure. Okay. So we're gonna go ahead and talk about the adolescents. This is obviously a very tumultuous time for parents. This is probably one of the most difficult times, hardest time to be a parent. So generally speaking, adolescence is, it ends, at the end of adolescence, you're really done growing, and your emotional maturity, sexual maturity is kind of approaching adulthood. We divide it into early, middle, and late. And generally speaking, it's 3 to 18, but it's kind of, adolescence, puberty, et cetera, can be starting a little bit earlier, especially in the girls. So there's some major challenges. Obviously, their body is changing a lot. They're also changing a lot emotionally, cognitively, the way they think. So in this age group, you always want to make sure that you're maintaining open communication and you're being cognizant of all of their stressors. So, obviously hormones are playing a huge role in this, and just kind of recognizing that. And then who can tell me what do you think the Erickson stage is for adolescents? Where are they in that Erickson stage of development?
Identity confusion.
Identity confusion. Okay, so identity versus role confusion. So this is where they're going to develop that sense of identity, or if they're not really dealing well, have role confusion. So this is where they really develop that sense of identity. They generally speaking have their first sort of relationship with somebody that they're sexually attracted to. So those are the two really things that are going on with them. So very good. Identity versus role confusion. So Piaget has this as abstract reasoning. So this is where they really definitely understand the concepts of cause and effect. Their math skills are a lot better. They're really thinking a lot more like an adult. And Freud has this as the genital stage. So the stage where they're really focused on sexual desires. So just generally speaking, understanding that this is really driven by hormones, hypothalamus signals your pituitary gland, and that kind of starts the whole process rolling. This slide here, you don't need to sort of go over all of this. This is kind of showing you all of the different ways that your body changes as you go through adolescence. So, it is important to remember, we kind of put this starting at age 13. Sometimes it's later, sometimes it's earlier. So there's not like a specific age. It's really when puberty starts that you're going to start thinking about adolescence. So generally speaking, these are kind of awkward kids. They tend to have like really long legs. They grow taller. They feel kind of awkward. They're sweating more. They can have bad body odor. They can have problems with acne. So, making sure that kids, adolescents know that this is normal, and you're going to, be non-judgmental and kind of address their issues, talking about bathing, talking about hygiene, talking about things to help their skin. So, I've told you a couple times. So generally speaking, girls begin before boys. So you might even start seeing some girls starting their period around age 10. That's and boys tend to be about 2 years behind girls. So there is something that I know that you need to know, which is the Tanner stages of sexual maturity. So slide 13 and then slide 14 kind of goes over what each stage is. So when you're talking about stage 1, there's no changes. This is like your pre-puberty stage, your child. So stage 1, no sexual development. And then you need to know that like it starts with, in boys, when sexual changes start happening, it's going to be their testes then enlarge first, and then girls, it's going to be breast budding. So I know that you need to be able to recognize like what the first signs of puberty are in boys and girls, and that's going to be Tanner stage 2. Boys are going to be testicular enlargement, and girls are going to be breast budding. On the slide before, it kind of goes through and shows you the picture of what they mean. So this is breast budding here. So one of the things that's normal during adolescence is they fluctuate between identities. So I don't know if you've ever known an adolescent, like maybe they're starting and they're really into rock music, and then they kind of go through a phase where they're into country music. Like it's almost like they're trying on different hats or different personalities, and they can change a lot throughout adolescence. So it's normal for them to like experiment and try different things. And what they're trying and what they're doing is very, very heavily influenced on whoever their peer group is. So peers are really, really important for adolescents. And also, you know, the sense of intimacy and trying out those first really intimate relations. They need practice in making decisions. So it's one of those things that you kind of have to let adolescents, you need to give them boundaries so they certainly know what are like hard stops that they're not allowed to do, but you also need to let them make some decisions and screw up on their own, because this is how they learn to make better decisions in the future. So obviously always remembering that even in adolescence, they're still part of a family and an environment. So always think about their cultural and spiritual considerations, and then remembering that they can be really self-conscious. They feel like people are always looking at their body, and it can make them feel uncomfortable.
Mhm.
Yes, someone said, "Mhm." Do you have an adolescent at home?
No,
But have you had that experience with adolescents where they're just constantly worried that people are looking at them, or they're really preoccupied with what they look like?
I do, and I have grandchildren.
Oh my goodness.
So,
Okay. So what were your kids like when they were adolescents?
mm, my son was shy. My girls, they just didn't want, like when would take them to a doctor, they didn't want a male doctor. They wanted females.
Yeah. Okay, that's normal. And would you try to
Hmm.
help them? Would you make sure that they got the doctor that they felt the most comfortable with?
I did.
Yeah. Those are all things that are important. You know, they're going to start to be able to express those things. And not every teenage girl is going to feel that way, but you certainly want
Hmm.
to let them start making those decisions for themselves. Um, this is where their peers are really important. They're going to start to form cliques. And just kind of when you're doing anticipatory guidance as a nurse, like making sure that parents know this. So what sorts of communication skills do you think work with adolescents? Like how should you talk to an adolescent? How should you frame questions? Who
That's
is
like a tricky balance, I feel.
Yeah.
So, I mean, how I approach it with my children, because I have boys and girls, but just try like a buddy system just to try to get information out of them and make them feel comfortable and not act like,
Hmm.
like a
So what do you
crazy
mean by a
mom.
buddy system?
Not buddy system, but just like kind of on their level, like word things that they
Okay.
can understand, and then they'll feel comfortable like opening up and, building that relationship.
Yeah. So I guess the thing is like starting to, you don't want to ask them out of the blue, are you having sex with your boyfriend? Because they don't trust you. So like starting to build that rapport, like having a conversation with them, getting them generally speaking to talk to you, and then ask them like an open-ended question like, how do you feel about teenagers having sex? Do you have, what's going on with your friends? And not necessarily directly asking them about them personally right at first, kind of like a broader question, and then getting them to talk to you and try to open up. So, and then always being non-judgmental, like, you might not like the answer that you get, but it's better that they're being honest with you and telling you what's going on, and not overreacting and and focusing on the negative. So it is a really hard time, because they really are prone to like risk taking behavior, maybe experimenting with drugs and alcohol, etc., maybe experimenting with sex. And so you want them to open up with you, but at the same time they're like afraid to do that. So there's a real fine balancing act. You want them to talk to you and trust you, but they're kind of intellectually prone not to, because they're so focused on their peers and what their friends are doing. So it's a really challenging time to be a parent. So like I said earlier, you should always be thinking about every theorist at this stage. So this is going to be your identity versus role confusion. For Erickson, Piaget, this is going to be your formal operations. Freud, this is your genital stage. So you should be able to think about what stage they're in based on that age group, and think about what that stage says about how they're developing. So by the time they're, ending adolescence and getting into adulthood, this is when they really have that abstract thinking. They can see situations from multiple viewpoints. They can sympathize and empathize. And they're kind of more morally, they're at the end of Kohlberg's moral stage of development also, where they have like an ethical sense of right and wrong. So obviously this is where, you're first going to really start seeing dating. There are certain things you have to worry about in adolescence. Unplanned pregnancy, sexually transmitted infections. These things can have really profound impact on the life of an adolescent. So does anyone have an opinion? Do you think that schools should teach sex education? What sorts of information should you be giving to like a 14, 15-year-old? What's appropriate to teach? Do you think they should know how to get access to birth control? This kind of general. What are your opinions about sex education in teenagers?
I think it's important, only because sometimes, their personal life isn't the greatest. So school is the only outlet that they are getting like pretty decent life skills information.
Okay.
So, I mean, my personal opinion is like, I'm all for it. I mean, we get a paper for like our school, and you're aware of like what the general topics are going to be, and you have to sign like a permission form.
Okay.
So, I mean,
Let's,
hey,
yeah.
knowledge is power. So,
Yeah. And I saw Virginia nodding her head. Virginia, what do you think about sex ed for teenagers?
I think it's a good idea. I mean, because kids tend to be promiscuous at a young age, and if that opportunity's there, why not?
Okay. So I'm just going to say, like, I respect everyone's viewpoint, and no one's opinion is the wrong opinion. I will just say that people who tend to be against sex education thinks that it encourages promiscuous behavior. Like if you talk about birth control, they're going to be more likely to go out and have sex. And that's not really supported by the evidence. I'm just going to kind of say, like, I respect everyone's opinion, and I think that your opinions are valued if you happen to think that children should not have access to sex education. But just from a statistical standpoint, there really isn't any evidence that talking about sex encourages sex. So generally speaking, most school districts are doing such sex education and, providing information about like where they can get birth control and what the signs and symptoms of sexually transmitted infections are. And generally speaking, we tend to believe that it helps them make better decisions. But, as a parent, you need to be kind of know where your values are, and you have the right to like not have your child expose that information at school. But thinking about age appropriate, their ability to understand information at certain ages, and also just I always in this section of the class, I always tell nurses to really know the laws in your state, because states are different in terms of a minor being able to consent to birth control without her parents' consent. So I would just look wherever you're going to be a nurse. Some states are more liberal than others. Some states, like the age of consent is like 15, and sometimes it's 18. So just knowing, depending on where you're working, you might be able to help, a 15 or a 16-year-old get birth control, even without their parents' permission. But it's really going to depend on the age of consent in your state. So this is just kind of reinforcing that, talking about sex doesn't necessarily make children more likely to have sex. And something that happens, I think that we're all aware, I'm going to say from my perspective, I remember when I was a teenager, like I didn't know anyone who was gay. When I was a teenager, I thought everyone was heterosexual. And then now I know all of these people that I went to high school with who were gay. So I think that our values of a society are changing. And obviously there are gay people out there, and we all need to recognize that, just because what we grew up thinking was normal is not necessarily a reflection of what society actually is. So just kind of recognizing that teenagers, if they're gay, they know they're gay when they're a teenager, and they're going to still be having the same desires and desire to relationships and being in relationships with other people. And it's also possible that people are just experimenting and they haven't really chosen or decided where they are, or there could be on the spectrum of maybe being bisexual and they're attracted to both genders or whatever. Just kind of like recognizing that this is this age group where this is really going to come out, and being able to prepare parents for this, because I think that for some parents, it could be really hard, and trying to have an open mind and being a safe place where children and parents can talk to you. I just always point this out because I feel like a lot of the theorists are kind of like old school, old minded. So just kind of, being aware that there's a lot of different sexual preferences out there, and that doesn't make anything, that doesn't, change where they are in the development spectrum or make them not be developing normally. So you need to make sure that adolescents have like a place to talk about their fears, that things can be really confusing, they can be really driven by their hormones, and making sure that you're keeping those lines of communication open. So if they tell you something like they're drinking and driving, you don't want to like shut them down and never have them come back and talk to you about what's going on in their life. So just making sure that you're keeping that rapport open and making sure that they can feel like you're a safe place that they can come and talk to you. So there's certain things that, you need to be paying attention to. Obviously, kids can get into trouble with the internet, et cetera. So paying attention to how much time they're spending online, if social media is a problem for them, if they're acting like they're depressed or they're like obsessed with their screen time, these are some things that should be red flags for you that you should pay attention to as a parent. And then also like getting into nutrition, I'm sure many of you have probably known adolescent girls that were skipping meals or dieting, or they were a vegetarian for a while and they didn't want to eat any meat. So this is this period of time when they're really, really concerned about their body, and that can really affect their nutrition. So being aware of that and trying to intervene and give them appropriate education. There's some certain things that are they're likely to be missing on: calcium, iron, vitamin B12. So iron, vitamin 12, this is going to be coming from a lot of your meat. There's a lot of teenagers that experiment with vegetarianism, and then calcium is going to be primarily from your dairy products. So obviously, you're still thinking about hygiene and dental health, et cetera. They do have more sweat production. They might need to bathe more as their adolescent years. Still focusing on personal things like sunbathing, making sure they're wearing sunblock, et cetera. You need to make sure you're paying attention to safety. So I know in your textbook, it still talks about motor vehicle accidents being the leading cause of death. I'm going to say I'm aware that gun violence is the leading cause of deaths in adolescents at this stage in our country. But if you're tested on it, your textbook still says that it's motor vehicle accidents. So just be aware that even though I know there's lots of reports out there, you should definitely be going on what your textbook says, because that's what's going to be on your test. So really focusing on motor vehicle safety, wearing seatbelts, et cetera. So specifically, females are kind of more likely to have problems with anorexia, eating disorders, et cetera. So there is this very specific phenomena that we see in adolescent females. It's called the female athlete triad. So it's disordered eating, amenorrhea, which means their period stops, and then they also start to develop weaker bones or osteoporosis. So this is like the teenage athlete that's really, really focused on competitive sports and also is not eating enough to support their physical output. So just to be aware that this is happening, and it is much more common in girls than it is in boys. So, drugs, alcohol, and sex, these are all things that we worry about with the teenagers. A lot of it has to do with their peer group that they're in. So as a parent, really paying attention to who your kids are hanging out with, and recognizing that peer group kind of can greatly influence, excuse me, what sort of risky behaviors they're engaged in. So this acronym, this PACE, parents, alcohol, cigarettes, education. So this is just kind of like getting you to think about the sorts of questions that you're going to ask kids. So if there's something going on, they have a risky peer group, or they admit that they're drinking alcohol. If you have more than 2 problems in 2 letters that indicate risky behavior or problematic behavior, then you would be needing to intervene, maybe get them into some counseling, et cetera. Also paying attention to depression, being cognizant, of suicide, death is something that we worry about more in adolescents than in the younger age groups. Sometimes, kids will be depressed and then they'll start using drugs, or it can go the other way around, that they start using drugs and that changes how they feel and they feel depression. So there can be a relationship between drug use and depression. Hopefully kids are going to schools where there's a school nurse or somebody that's really kind of paying attention to changes in behavior, making sure that they have access to the hotlines, referrals to counselors, et cetera, if they need them. So unfortunately, kids get pregnant. So being aware of the fact that this could happen, and making sure that they have the resources to make decisions regarding their pregnancy. So general, teaching points for adolescents is making sure you have good communication, open any questions, making sure that you're providing a safe space for them to come and talk to you, still respecting their privacy, making sure that, you're being honest with them, and if you're going to respect their confidentiality and their privacy. And then also just recognizing that it is very, very normal for them to rebel and to really, really focus on their peer groups, and to have that, they have that sense of invincibility, like they don't think anything bad is going to happen to them. Those are all normal things that happen during adolescence, and to try to give parents the tools to deal with that in their children. So, there's a lot of different aspects of nursing care for the adolescent. We talked about nutrition. Maybe they're experimenting with different diets, or they're really focused on their body. They still obviously need dental care. They need to bathe more frequently because of their body changes. Accident prevention, talking about substance abuse, risk-taking behavior, learning about money. They're going to be entering adulthood and being responsible for their own money. And then just in general, always doing the open-ended questions. So I know that's a lot of information. I think the main things to remember with adolescents is like the open communication, kind of recognizing the things that they're going through that are different than the other age groups. And then helping parents deal with those unique characteristics of adolescence. So does anyone have any questions about the adolescent information? Nope. Yes, nope. Okay. I'm going to go ahead and pull up your Kahoot, and it's going to go over some key points for this week. I just want to make sure you guys remember that your quiz is really over week 1, not week 2, but I want to make sure that you guys have access to the Kahoot just to help you study for your test that'll be coming up. So just 1 second, I'll pull it up, and then you guys will take your Kahoot and you'll come back. And when you come back, you'll take. Sorry, I muted myself. I'll turn your quiz on when you're on break. So I'll pull the Kahoot up. We'll take the Kahoot, and then you'll go on break. And when you come back, you'll take your quiz. Okay, I'm going to go ahead and get started here. A preschool child is asked, why do trees have leaves? Which response would be example of animism? Because God made them that way, so I can have shade over my sandbox to hide when they are scared, or for the squirrels to play in. Okay, so the animism is this kind of belief that things that are not human have human characteristics. So, all of these other ones, because God made them that way, so I can have shade over my sandbox, that's not really giving the tree the human characteristics. So that to hide behind when they're scared, that's the animism. So like obviously trees do not have human characteristics, but if they say something that gives the tree a human characteristic, that's an example of animism. So what task would be appropriate for a 5-year-old child? Carrying glasses from the table to the sink, scrubbing out the sink with a cleanser, washing the dirty knives, or setting the table with paper plates. So very good. I think you guys got all this. 5-year-olds, they like to help, but you don't want them involved in anything that's going to be dangerous. So the best thing would be, setting the table with the paper plates for that age group. So a father is concerned about how long his preschool age children will continue sucking his thumb. What is the best response? Place liquid thumb to make it taste bad. Distract the child whenever he sucks his thumb. Tell them that thumb sucking can cause damage to teeth and must be stopped right now. Or tell them that most children will stop sucking their thumb naturally by the time they're school age. All right. So yeah, most of you got that. So it's something that parents worry about a lot, that as long as their permanent teeth aren't coming in, it's not going to cause any damage if they just have their baby teeth. And they usually stop doing it. So focus on some positive reinforcement, but you don't want to do negative reinforcement. And usually they just stop by the time they're about ready to start school. So how should the nurse suggest what should the nurse suggest is the most appropriate toy for a 3-year-old? A small pet like a goldfish, a large construction set, a board game, or push-pull tops or toys? So yeah, push-pull would be a little bit younger, probably more like the toddler years. Board games are not old enough yet. So that construction set like the blocks where they can build things, that's going to be the best thing for a 3-year-old. They're starting to being interested in building things, creating things. What fear is unique to the preschool period? Death, water, bodily harm, or animals? Good job. So they don't really necessarily understand death, but they are worried about their own personal body being hurt. So if they cut their hand, they're worried that it's going to be cut off or something like that. They're very worried about their body being harmed. So when planning an activity for a 3-year-old, the nurse bases the plan based on the average attention span of how many minutes? 10 minutes, 15 minutes, 5 minutes, or 20 minutes? So I was surprised, to be honest with you, but this is like the full activity. So certainly don't plan to do anything that's going to be more than 15 minutes. They're not going to be able to sit there and pay attention. So a 4-year-old insists he has more money with a nickel than his father has with a dime. Per Piaget, why does the child think that way? Intuition, egocentrism, animism, or artificialism? All right, a couple of you got this right. This one is hard. So intuition. So which is bigger, a nickel or a dime?
Nickel.
Nickel. So they think it's worth more money because it's bigger. So this is kind of like they don't really understand the value of coins, but when something's bigger, they think it has more value. So that's kind of their intuition getting in. Egocentrism is that they think all about themselves, which I can see why you would think that, you know, if you have your nickel, you think it's worth more because you're only thinking about yourself. But this is really getting to the idea that like they view the world and how big something is or what the size is, and that's going to determine its value. So what should the nurse keep in mind when planning to teach a class about nutrition to 4th grade students? School-age children can think abstractly. School-age children are egocentric in their thinking. School-age children think logically and concretely, or school-age children can concentrate on only one aspect of a situation. Okay. So I think if you thought about the name of the stage, so we're talking about planning, teaching, you're talking about cognition. So this is a question that's looking at Piaget. So what stage would Piaget put the school age child in for a 4th grade student? What stage is that for Piaget?
7 to 11.
And what's the name of the stage?
Operation, concrete operational.
Concrete operate, right? So this is the school age. This is where I would remember the school age is concrete. So concrete thinking is logically and concretely, like they're starting to understand math, they're starting to develop logic. So abstractly, that's going to be your formal operations more in your adolescence. School age children aren't nearly as egocentric as the preschool and the toddler. And, you know, school age children can concentrate on only one aspect of a situation. That's starting to change. They're really to be able to think about more than one. So the main thing for the school age is that they're really, really logical and concrete. And that's the concrete operations for Piaget. So an 8-year-old child has frequent nightmares and the parents are concerned. What is the best response from the nurse? Nightmares are a normal response or an abnormal response to repressed feelings. They are a side effect of overactivity and stimulation. They are a common result of latent sexuality, or they're a normal extension of the child's fear of mutilation. All right, good. So this is that age where they're really afraid of bodily harm, etc. And so it's normal. Kids have normals at this age group, and parents need to be aware of the fact that it's not necessarily that means that there's something wrong, that a lot of kids have nightmares. So a 10-year-old girl likes school, she plays the flute, and she plays tennis. What do these activities help develop? Industry, identity, intimacy, or initiative? All righty. So this is getting into the Erickson. So this would be your Erickson stage of industry versus inferiority. So you want them, you know, at this stage, develop that sense of industry. So that's what this was trying to get you at. So looking at a 10-year-old and then recognizing what stage that would put Erickson in, and then identifying the skill or the virtue that should be developed in that stage. So what statement by an 11-year-old would lead the nurse to determine he has moved from the mindset of egocentrism? I must do my homework before I can play. I'm a member of the best Cub Scout in the world. I'm sorry, I bet that hurt your feelings, or my dad can do anything. So moving away from egocentrism. Good. So I'm sorry, I bet that hurt your feelings is thinking about the other person. So this is not so egocentric. So I must do my homework before I play. It's still all about me. So this is the best answer here is that, you know, they're thinking about someone else. So the school nurse is preserving a tooth that was knocked out. What will the nurse do to preserve the tooth? Place it in a warm environment, wrap the tooth in a loose cloth, handle the tooth by the crown only, or rinse the tooth with alcohol. So we did talk about it. So this is like so that you can preserve the tooth. You actually put it in milk if you put it in anything, and then you want to hold it by the crown and not touch the root. So that's why, since clean cloth is not the best answer, because if you put it in something, you really want to put it in a glass of milk. So the nurse is assessing a 13-year-old boy. Which physical change indicates male puberty has begun? Enlargement of the testicles, enlargement of the penis, development of axillary and facial hair, or pigmentation of the scrotum? All right, very good. So this is your Tanner stage 2. Boys is testicular enlargement and girls is breast bud. First things that you see to indicate that puberty is starting. So a parent comments that her adolescent daughter seems to be daydreaming a lot. What does this behavior indicate? That she's bored, she's trying to block out stress and anxiety, she's not getting enough rest, or she's mentally preparing for real situations. All right, so good job. Adolescents, they need to make decisions and make mistakes, and they also need to have some time to daydream. They need to be able to think through how things might happen and what sorts of decisions they could make and have that ability to think through things. So this is normal for adolescents to daydream, and it is a process that they go through to help them think about how they'll deal with situations. So the nurse is planning care for an adolescent. What psychosocial task is most important for the adolescent? Sense of industry, a sense of initiative, a sense of involvement, or a sense of identity? Very good. This is your sense of identity. This is another getting you to think about Erickson. This is the Erickson stage of identity versus role confusion. So this is really what the thing that adolescent stage is focused on. So what can a nurse suggest as a good dietary source of zinc for an adolescent who's a vegetarian? Enriched breads, nuts, citrus fruits, or green leafy vegetables? So this, we didn't specifically get into zinc. So green leafy vegetables are good sources of iron. So this specifically would be the nuts. The main thing that I want you to think about is like what you would do if you had a child, teenager that was a vegetarian, and how you would advise them on their diet. Okay, last one. So a girl tells the nurse, I love Katy Perry. I want to be a singer. This statement is typical of what stage? middle adolescence, the entire adolescent period, late adolescence, or early adolescence? All right, so this is the early adolescence. It also kind of starts happening maybe a little bit at the end of school age. This is this hero worship. So they really, really focus on somebody that's famous and they want to be just like that person. All right, so I have no idea who Leanne Rhymes is. Who's Leanne Rhymes? Anyone going to own up to being Leanne Rhymes? Keep scrolling through here. And then Pinecone. Who's Pinecone? Well, good job. Thank you for participating. I'll put the Kahoot in the announcement so you guys can practice the Kahoot at home. So I'm going to go ahead and give you another 10-minute break. And when you come back from your 10-minute break, your quiz will be turned on. I just want you to touch base with me. I'll make sure everyone's camera's on, et cetera, before you take your quiz. But go ahead and take your 10-minute break and come back and we'll take your quiz and then you'll be free to go. Okay? Okay, welcome back, everyone. It looks like people are still coming back in, so I'm still waiting for everyone to flip their cameras on. So just give people a minute to come back and then you guys can start your quiz. So hold on a second. Okay, so I'm waiting for Donna, Chanel, and Tamu. You guys can go ahead and flip your cameras on. Thank you, Donna. Chanel, just Tamu. Whenever you're back, Tamu, go ahead and flip your camera on and then we can all get started. Thank you. All right, everyone. Hopefully you can see your quiz. Let me know if you can't. And you guys can go ahead and take your quiz. And then when you're done, you can log off unless you want to stay on and ask me any questions.